we're back now with 843 TV at the Bluffton Jasper Volunteers in Medicine, and we're going to be talking with some of the staff here. And first, we're going to be talking with Dr. Kathleen Casey, the medical director, and also Dr. Evans, and about your roles here at the clinic. And I know both of you are very vital to what goes on here. So let's talk about your background. We'll start with you.
Okay, well, I'm an infectious disease physician by training, and as part of what I did through my career, I was mainly a hospitalist because most of my time was spent in an acute care setting. But I ran a primary care HIV clinic for years with indigent care, of course, associated with that. I did public health and TB and STD. So a clinic background is very much part of me, and I adapted very well to being able to do primary care in this setting. And it's a relief not to be constantly in a moment of emergency. So I enjoy the time that I have to speak with the patients here.
Oh, that's great. And how about you, Dr. Evans?
I was an academic surgeon, teaching other doctors how to be surgeons. Most of the time I did trauma. But as part of our departmental surgery outreach, we provided the surgical service for the entire Western New York prison system. So I had a lot of clinic time behind bars. And after many, many years of the Gun and Knife Club, I decided to recycle into general practice and do general practice here.
So both of you have had quite an extensive background. That's really amazing. That speaks to the level of physicians and care that one can get here. So let's talk about the need. There's such a need now for staff. Share with us what you all are in real need of as far as filling these roles that you have to help the patients.
Well, the number of patients is going up because the need is increasing in many different categories. But the pandemic has really exposed the serious lack of sufficient primary care in the Lowcountry. And as you know, the 4 counties in the Lowcountry have the highest incidence of diabetes in the state. So we see a lot of patients who have diabetes. And we also see a lot of people who just need primary care for other common illnesses. But the need is there for everything. So anybody is welcome. We need doctors, nurses, volunteers, donors. So we would reach out to people. In the past, we've had people who are in practice here who donate some of their own time. And so that's a possibility. You don't have to be a non-practicing physician. You can be practicing and still provide community service. And the service we provide is not just to the patients, which is a critical factor about why you want to be here. Right now, every week we see people that we save. We provide a community service. We provide, if somebody has untreated diabetes, goes to the hospital, eats up ER time, and then needs to be managed, we do that. We save the hospital lots of money by seeing those patients. But in addition, we make it possible for somebody who's going to the ER to avoid having a crowded line by keeping those people out of the hospital. So I don't like for people to say, oh, Doc Evans just sees the poor people. I take care of everybody because we provide a community service.
That's wonderful. That's so wonderful. That's something that people assume what you mentioned. It's just for those who really can afford it or need, but you provide such a great service and helping out the hospital for sure.
Well, we have a real relationship with the hospitals. Yes. And when patients are being discharged who didn't have a primary care physician and don't have insurance, they notify us and we prioritize getting that patient in immediately into care so they don't bounce back to the ER 3 weeks later because no one was able to take care of them. And we actually go as far as giving the glucometers, so the patients who monitor their own blood sugars, we give the glucometers to the hospital that we can supply.
Sure.
So the patient's discharged with the equipment that we can continue to train them with and monitor their sugars with. For instance, that's just a small idea of the way we can collaborate with the hospitals. So I think it's very important for them. We help declutter their emergency rooms. We help them get patients out who otherwise they would know would just bounce back immediately, but are falling into good hands, that we can care for them.
That's so important, especially in the last few years. You hear about cluttering and waiting in line in ERs and just medical facilities. So
well, and patients actually who have fallen out of care in other capacities go to the emergency room just to get refills. And that's a terrible waste of their time and the emergency room's time to give medication refills.
Sure.
Where if they fall into a primary care practice like ours, we help do that. So that's, he's right. It spills out into the entire community. We make life better.
Absolutely. Now, you mentioned this is not just for retired physicians, that you can be currently practicing and still volunteer time. So let's talk about the different licenses that you're looking for. What's the differences between a volunteer license and what is the qualifications, or what are the criteria, I should say?
Well, South Carolina is truly unique in that somebody before our time managed to convince our legislature that in order to provide free care, that they needed to provide a pathway for physician licensure that was straightforward and free. So a volunteer license, which restricts your practice in the sense that I can only practice here, can't practice anywhere else, but I practice here, and my license in South Carolina says I'm a volunteer physician, but it gives me all the privileges of everything to do as a physician. So it's a great opportunity, and it really relieves the burden of becoming a very useful volunteer physician. There's not a barrier to it, as there are in many other places.
Anything you want to add to that?
Well, I was strongly encouraged by our previous medical director to get a regular license, which is what we both had in our respective careers. And so I did it before I came down here, knowing that I was in part choosing Bluffton because I wanted to work here. This was my idea of retirement, so I wanted to do it. But it's because he secretly knew he was going to resign and hoped that I would take the medical directorship. So someone here has to have a regular license.
Sure.
And several of us happen to. But I, in my capacity, really have to. So it was a little bit more burdensome than getting a volunteer one, but it wasn't prohibitive. And what we're really getting at is that the physicians who've already seen the light and moved to the Lowcountry because they like the lifestyle and they want to stay here when they retire, we should be part of their retirement plan. And maybe they'd like to get their feet wet and work one evening a month or something in this capacity, and then they'll just ease their licenses into a volunteer license if they wish, or maintain their regular license. But I think one of the misconceptions that many of my friends and neighbors have about us is that we only take care of people who have no jobs. We take a huge percentage of our patients have jobs, they just don't have benefits.
Yes, right.
And I think everyone can get into understanding how devastating that is in terms of medical care. And so we're really reaching out to a wide swath of the community, not just the people who, can't afford care.
Sure.
So I think it's very important for people to realize that. And Ridgeland is a unique situation. It was much slower to develop in terms of the volunteers in medicine. We've only been up there a few years. And those patients I'm beginning to see after my 3 years of doing 1 day a week there and 1 day a week there really are a little different. And we're seeing people who are coming in with much more advanced deterioration from untreated hypertension, untreated diabetes, untreated many diseases. And we are tremendously interested in reaching them 10 years earlier.
Yeah.
We want young adults to realize that they need to get connected with medicine so we can intervene with these things, so we don't see this culmination of many years of untreated illness.
Sure.
So, and then the last point I want to make about who we need to recruit here is people think we're all primary care physicians. You've already found out that neither of us were primary care
I know.
physicians.
I was amazed at what you told me your background was.
Our previous medical director was a pediatric anesthesiologist who retooled in internal medicine. We have ER physician. We have a retired cardiologist. And amazingly, we have more subspecialists than we have people who did primary care for a living. So anyone we can find a niche for. And so we're really trying to reach out. And, the nurses also come from a variety of backgrounds. We have public health people. We have, people who did intensive care nursing. We have all sorts of variety of nurses who find a home here and are very happy. And I think what the video that we made before really highlighted, certainly for Dr. Evans and I, is we have a really special relationship with the nurses who come and help us with our patients. And we see this as a team approach. And it's really fun because, you and the nurse will chat about that patient. You may have different takes on what's happening. It's a collaborative care opportunity. And I think nurses really like collaboration.
Oh, yeah.
And this is an ideal setting for us all to kind of have fun doing that.
Sounds like a great network for everyone to be part of. That for sure is just listening to that. It sounds like exciting for sure. And dental care, just touch base on that. That's one addition as well.
Yes, it is probably the number one need in the sense of actual total numbers. Since I started 6 years ago, I would have to say maybe, it seemed like every week, but I'm sure it's not every week, but we had so many people who come in with tooth abscess that you need to prescribe antibiotics until they can possibly find some help. And that's not readily available until now. And that's really an important element. Preventive dental care so that you don't wind up with an abscess and swollen lymph nodes and a inflamed neck and fever and things, and that's what people come in. So it's an important addition to our care. In addition, we also have podiatrists now, and that is a big addition because diabetes, one of the main problems is foot care, making sure that the people don't have, that's one of the things that leads to amputation in diabetics is poor foot care. So we have really good care for the people, but we need more help. We just there's more need than there is help. So
Absolutely.
That's the big deal. And it's really the concept about the team is really important. And it starts at the top and works down. Our board members are very attuned to what the needs of the community are, and they help in directing that. And we have a pharmacist who works. And fortunately, that makes things really easy because when he's here, it just goes very quickly filling out the things that need to be done. So we have a lot of reasons if you want to have a pleasant experience, seeing people who really need your medical attention, this is the place to be.
Well, this has been very educational, and we hope that the viewers have enjoyed it. And the video is great. And if you missed the video in the first segment, make sure you tune back in. And this is it from 843 TV today, the Bluffton Jasper Volunteers of Medicine. Thank you for watching.